Top 10 Best Paid Medical Specialties and Why They're Worth It. The healthcare industry is an extremely competitive field with so many different jobs that it can be difficult to decide which one is right for you. With so many options, it's important to choose a specialty that aligns with your personal interests and career goals. You have probably heard about doctors not being paid enough. Well, that is true. According to the American Medical Association, the median annual earnings for physicians in the United States in 2016 was $207,100. That might seem like decent money until you compare it to other professions. Even so, more and more people are becoming doctors every year because we understand how rewarding and impactful this career can be on our lives. But that's not all. Doctors also get paid differently based on their specialty or area of expertise. The level of training and education required to become a doctor is extensive and stressful, but also extremely rewarding for many different reasons, including financial ones. Here are the 10 best paid medical specialties that will help you make your decision easier when choosing a future career as a doctor. Anesthesiology. Anesthesiologists administer anesthesia for patients who are about to undergo a surgical operation to make them unconscious, unable to feel pain, and able to breathe on their own. Anesthesiologists are responsible for the safety of the patient throughout the procedure and also closely monitor the patient's vitals during surgery. Anesthesiologists typically work in hospitals and other surgical settings, such as outpatient clinics and ambulatory surgery centers. They often work long or irregular hours, including weekends and holidays. In addition to earning a high salary, anesthesiologists benefit from a high job satisfaction rating. The field is expected to see a 10% growth in job openings between 2016 and 2026. The reasons include an increasing number of surgeries, especially in specialties such as vascular surgery and gynecological surgery, as well as the aging population. Cardiology. Cardiologists specialize in the diagnosis and treatment of diseases related to the heart and blood vessels, such as coronary artery disease, heart failure, and arrhythmias. They work closely with patients to identify risk factors for disease, diagnose problems, and create a treatment plan. This can include administering medication, performing surgery, or inserting a device to open narrowed or blocked blood vessels. Because heart disease is the leading cause of death in the United States, cardiologists play an important role in preventing death and improving the quality of life of their patients. Cardiologists earn a high salary, have excellent job prospects, and also have a high job satisfaction rating. Despite the high demand for cardiologists, the number of people entering the field is expected to remain steady. Therefore, competition for cardiology positions will remain high. Child and adolescent psychiatry. Child and adolescent psychiatrists specialize in the diagnosis and treatment of mental health disorders in children and adolescents, including behavioral and emotional problems, issues related to learning, and certain types of mental illnesses. Child and adolescent psychiatrists often work with parents and other caregivers to help children and adolescents manage their mental health issues. Many also work with schools and other social service agencies to help children receive the support they need. As the number of children with mental health disorders increases, the demand for child and adolescent psychiatrists will also rise. Child and adolescent psychiatrists earn a high salary, work fewer hours than many other medical specialists, and enjoy a high job satisfaction rating. Diagnostic radiology. Diagnostic radiologists specialize in reading and analyzing imaging tests, including X-rays, MRIs, CT scans, and ultrasounds. Diagnostic radiologists interpret these tests to diagnose and treat diseases and injuries in various parts of the body. They use imaging to guide minimally invasive procedures, including biopsies and surgeries, to ensure accuracy and minimize risks to patients. The increasing use of imaging tests, especially for diagnosis and detection of diseases, will significantly drive demand for diagnostic radiologists. In addition, the retirement of many current diagnostic radiologists will create additional job opportunities. Diagnostic radiologists earn a high salary and have excellent job prospects. Emergency medicine. Emergency medicine physicians provide immediate care and treatment to patients who are experiencing a medical emergency, such as a car accident, a heart attack, or a serious injury. Emergency medicine physicians often work in hospital emergency rooms, ERs, but some also work in other settings, such as urgent care clinics and ambulances. Because emergency room visits are unpredictable, emergency medicine physicians may need to work long or irregular hours, including nights, weekends, and holidays. As the number of people needing immediate medical attention increases, the need for emergency medicine physicians will also increase. Consequently, demand for emergency medicine physicians is expected to grow. Internal medicine. Internal medicine physicians specialize in the prevention, diagnosis, and treatment of diseases and disorders that affect the human body's internal organs. They initially focus on screening, diagnosing, and treating acute and chronic illnesses, such as diabetes and heart disease. As patients' conditions improve, internal medicine physicians may continue to provide long-term care or transition their care to another type of physician, such as a surgeon or a specialist. The aging population will drive demand for internal medicine physicians, since people over the age of 65 have the greatest need for these services. In addition, the number of people with chronic conditions, such as diabetes and heart disease, will continue to increase, leading to an increase in the number of patients who will require the services of an internal medicine physician. Interventional cardiology. Interventional cardiologists specialize in minimally invasive procedures to improve heart function and manage heart diseases. They use imaging, including X-rays and ultrasound, to guide a variety of procedures, such as installing stents and balloons for narrowed or blocked blood vessels, opening abnormal heart valves, and performing angioplasty and heart surgery. The increasing use of interventional procedures and the rise in the incidence of heart disease will drive demand for interventional cardiologists. In addition, the retirement of many current interventional cardiologists will create additional job opportunities. Interventional cardiologists earn a high salary and have excellent job prospects. Neurology. Neurologists specialize in the diagnosis and treatment of diseases and disorders related to the brain, spinal cord, and nerves. This includes Alzheimer's disease, epilepsy, stroke, and multiple sclerosis. Neurologists perform imaging tests, such as MRIs and EEGs, to help diagnose these diseases and determine the best course of treatment. Neurologists typically work in hospitals and private settings, such as clinics and outpatient facilities. The growing senior population and the rising number of neurological disorders will drive demand for neurologists. In addition, the expected retirement of many neurologists will create job opportunities for other neurologists. Obstetrics and gynecology. Obstetrics and gynecology physicians provide healthcare services related to women's health during their lifetimes, including reproductive health and pregnancy, diagnosis and treatment of diseases in the female reproductive organs, and healthcare during and after menopause. With an aging population, OB/GYN physicians will increasingly provide women with specialized care during menopause and for chronic conditions, such as diabetes and heart disease. In addition, the average age of OB/GYN physicians is increasing, and many are expected to retire in the coming years, creating job opportunities for other OB/GYN physicians. OB/GYN physicians earn a high salary and have excellent job prospects. Orthopedic surgery. Orthopedic surgeons treat conditions that affect the musculoskeletal system, such as broken bones, joint injuries, and degenerative diseases. They also help people recover from surgeries, such as joint replacement. As people age and experience degenerative diseases, such as arthritis, the number of people who will require orthopedic surgeries and joint replacements will increase. In addition, advances in technology and surgical techniques will lead to more complex surgeries and procedures. As a result, the demand for orthopedic surgeons will increase. Orthopedic surgeons earn a high salary and have excellent job prospects. Conclusion. Choosing a career path is not an easy task, especially when there are various factors to consider, such as the amount of money you can make, the level of stress you will face, and the culture of each company or workplace. Hopefully, this article helped you make your decision a little easier. If you are pursuing a career in medicine and want to be a doctor, the advice in this article will help you choose a medical specialty that not only fits your interests and skills but also has a high salary and good job prospects.